Welcome to the Home Health Care Today show. I'm your host, Dr. Cleamon Moorer. We are going to focus today on World Oral Health. So, March 20th was World Oral Health Day, and we have the honor and pleasure to be remote from our normal studio. We are filming today at the Delta Dental of Michigan, Detroit's office. And not only are we filming here, we have the honor and pleasure of having our conversation with Dr. Michelle Kohler. Dr. Michelle Kohler is the Chief Dental Officer for Government Programs with Delta Dental of Michigan. A quick fact about dental health. Oral diseases affect nearly 3.5 billion people worldwide, making them among the most common health conditions on the planet. Yet, here's what many people don't realize. Your mouth is a window to your overall health. Research shows that gum disease is linked to heart disease, diabetes, and even Alzheimer's. A healthy mouth isn't just about a beautiful smile, it's about a healthier you. Now, back to my introduction of Dr. Kohler. Delta Dental is one of the nation's largest dental benefits providers, serving millions of members across the state. With her Doctor of Dental Surgery and Master of Public Health degrees, Dr. Kohler brings both clinical expertise and a population health perspective to improving oral health outcomes. She leads Delta Dental's quality improvement and population health team, working to expand dental access to underserved communities through innovative programs like Healthy Kids Dental Program and partnership programs with safety net clinics across Michigan. Her work has helped to open new dental clinics in Mount Clemens, Traverse City, and Detroit's first LGBTQ plus affirming dental clinic. Dr. Kohler, welcome to our show.
Thank you for having me. I really appreciate the opportunity to chat a little bit about oral health.
All right, wonderful, doctor. So let's just dive right in. Okay, the mouth-body connection. Okay, and you, as you think about dental health and overall health, let's go there. You dedicated your career to improving oral health, not just for individuals, but for entire communities. What drew you to dental, public health? And what drives your work as Chief Dental Officer of Government Programs at Delta Dental of Michigan?
Yeah, so I've always been interested in dental even since I was a little kid. I really enjoyed going to the dentist, and fortunately I had great teeth. So
Yes.
the visits were always very easy, but it wasn't always something that I had the opportunity to do. I lived in a small rural community, so
Yes.
there was only one dentist, but
Uh-huh.
we also didn't have insurance.
Okay.
So being able to go wasn't
Yes.
always in the budget. And when I did have the opportunity to go, I loved it. So
Okay.
as I moved through my schooling and things like that, I decided I wanted to be a dentist. And then as I got further into my career and started practicing, I had the opportunity to work at a clinic that was put together by a pediatric dentist solely through donations. And this was in northern Indiana, and it was part of a WIC clinic. And that really showed me what the need out there looked like for the
Yes.
underserved population. And it also showed me what you can do as a dentist to be able to serve them. So that was where I started my career with Medicaid and focusing on that underserved population. I fell in love with that clinic and being there and practicing.
Awesome.
And
Okay.
then, eventually became a state administrator and found my way to Delta Dental, because part of our mission at Delta Dental is access to dental care for all.
Mhm.
And we have been working with the Healthy Kids Dental population for the last 26 years in
Yes.
Michigan. And we've been working with the Adult Healthy Michigan program for a number of years as well. So I really enjoyed the opportunity to be able to work not only on the clinical side, but also with getting members the care that they need and reducing barriers.
Wonderful, wonderful. I love the journey. And it started as a kid loving to go to the dentist. So, I got it. So we understand like, in a lot of the pediatric dental clinics, we can make it really comfortable for kids to, get their teeth clean and learn about oral health. But how about the adults? As we think about World Oral Health Day, a happy, mouth, happy, oral health, happy life. How do we get people to kind of buy into that notion?
Yeah, I think really placing the emphasis on how the mouth connects to the body is an important place that we don't always go, but
Yeah.
we're laughing, we're talking,
Yes.
we're, eating foods that nourish the rest of our body. And I think a lot of people overlook the fact that it is the entry point for a lot of things. And
Yes.
it's hard to go to work and do your job and be able to communicate with your coworkers or customers or whoever
Yes.
it may be if you have pain in the mouth.
Yep.
It's hard, if you have other medical conditions to be able to eat properly if your teeth aren't able to do the work that they need to do.
Yes.
And so I think it really becomes a little bit of a connection between not only what your medical provider is telling you about your physical health and what
Yes.
you need to do there, but getting your oral health in alignment with that as well. And it becomes obviously a preventive
Yeah.
type of process,
Mm-hmm.
going to the dentist, of course, but we really believe starting early is important. So
Indeed.
trying to get kids to the dentist,
Yep.
as you mentioned, but certainly it's never too late to start going.
Yep.
And people shouldn't be afraid to go. If you have questions about going to the dentist, the first place to go, obviously you can ask the front desk, find
Yes.
an office that you're comfortable with. And a lot of dentists now will do introductory visits or screening visits and things like that where you can try to see if the office is the right fit for you.
Absolutely.
And,
Yeah.
they can talk a little bit more about the things that they need to do before you even have somebody look in your mouth or try to take x-rays or things like that.
That's it, Dr. Kohler. So when you talk about that connection, which is so important, people can make the clear connection between, hey, my dental or my oral health and, my stomach, my digestive system, what I just ate, got it. I feel it here. But how about our other organs? What's that, in layman's terms, that connection between, say, oral health and heart health?
And that is a
Yeah.
really important connection. And there's been a lot of
Yes.
research
Hmm.
focused on the cardiac health and the relationship to oral health.
Yes.
And what's interesting is a lot of people don't think about the bacteria that cause the decay in the mouth.
Yeah.
Or, some people are probably familiar with the term periodontal disease or
Yes.
gum disease. And there's a different set of bacteria that is responsible for that process.
Okay.
So if you have periodontal disease, gum disease, or if you have decay, there's a set of bacteria in your mouth that can then travel to other places within your
Wow.
body.
Yeah.
And that's how we end up with that heart connection. There's been some research out there that has shown for victims of heart attacks and things like that, blockages,
Yes.
that there are oral bacteria contained in those lesions.
Yes.
And so they're really making the connection between what type of bacteria it is,
Yep.
what process in the mouth is responsible for that bacteria, and more importantly, how do we get rid of it?
Yes.
So that way, you may be doing all of the things that your doctor recommends, but if you still have that gum disease, you still have the decay
Yes.
in your mouth, it is feeding that bacteria into the heart or to other body systems like the respiratory system.
Yes.
And it is affecting your ability to, be more physically fit and to have that overall health that you really seek.
Absolutely. Absolutely, Dr. Kohler. So, warning signs, right? So, as we get into that, there are some people that could say, okay, well, maybe my appearance, right? Or maybe there is an odor, right? Maybe there's bleeding of the gums. What are some other, like, maybe not as obvious warning signs that, hey, I need to check in with the dentist and focus on my oral health?
That's a great question. And you named a couple of the key ones there.
Yes.
Definitely bleeding of the gums is important because,
Yes.
we always say in dental offices as a provider, if you cut your arm and your arm was bleeding, you would do something to stop the flow of blood and to treat it.
Definitely.
You wouldn't just accept it as part of an
Ex-
everyday occurrence,
Exactly.
which is unfortunately what some patients think of when they're brushing their teeth
Like,
or
oh,
they're
it's
flossing.
okay. Yeah.
Yeah, absolutely. I would say any kind of mouth sore that you can't explain.
Mhm.
Obviously, sometimes you bite into something, you get a little cut on the roof of your mouth or something like that. That's fine. But sores that you can't explain in the mouth, even just a change in the texture and the feel of the saliva
Mm.
in your mouth. We see a lot of patients that take multiple medications. They suffer from dry mouth.
Yep.
But certainly, if that's not the case for you or it hasn't been the case in the past, you need to get that checked out, because any change in saliva quality affects not only the teeth, but it does sometimes indicate that something else is happening in the mouth as well.
Absolutely.
So I would say kind of the three key ones for me are the bleeding gums, the changes in the saliva, and any kind of sore or change in kind of in the texture of the gum tissue in your mouth.
We talked about warning signs, and they've already, presented themselves, right? A challenge has been presented. What about prevention? What do you recommend?
So we always tell patients, of course, and I think a lot of people have heard this, brush twice a day and floss once a day. But sometimes that can be a little challenging.
Sure.
So, I always tell my patients one step in the right direction. So at least brushing once a day is a great step to trying to get your overall health and your oral health under control. Because if you can make that a habit, then that is a step in the right direction. Certainly twice a day is ideal. Also, I tell patients to rinse. So if you are not able to brush after meals, or maybe you don't have a toothbrush available, or ran out of toothpaste or something like that, even brushing with water, rinsing with water is important, because it does clear out any debris from the food that you've eaten, things like that in the mouth. And it helps to keep the the tissues healthy, the saliva flowing, and things like that, which is really important for keeping the teeth healthy. So I always tell patients to do that. But it really is a one step at a time type of prevention process, because you've got to start somewhere.
Absolutely.
And when you come to the dentist, I know a lot of times patients can be a little discouraged if they hear that they have cavities, or they hear that they have something else going on with their gum tissue, and they may not think that they can make a change, but they can. So even brushing for 30 seconds, that's perfect.
Absolutely.
If you have the ability to try to invest in an electric toothbrush that has a timer, sometimes that makes things easier. Now they have apps on your phone that can send you reminders as well to make sure that you brush or floss. But flossing for me, it is important as well. But the first step is getting in there and brushing consistently, at least once a day, if not twice a day after meals.
Kohler,
especially before bed.
See, insightful information, not scary, step by step. Prior to a commercial, we got a few seconds here. The caregiver. If I'm responsible for taking care of someone else, what do you recommend?
Recommend talking to your dentist about it, even if you are just speaking as the caregiver and not necessarily there with the person that you're giving care for. There are a lot of different dental aids out there. There's modified toothbrushes and things like that you can get. And it really helps for someone who's trying to get into that small space and help the other person to really maintain that oral hygiene as well.
Absolutely.
So, using kind of the typical methods doesn't always get there. Certainly, there's a lot of different options out there from a floss perspective. There's the floss holders, and there's the picks and things like that. All great tools when you're trying to get in there with someone else. But definitely some modified grip and some different types of toothbrushes and things like that are available, and you can either order them through the dentist, or definitely Amazon and other sites like that available to get some of those things. But it does help you take care of the teeth more efficiently.
Very good, Dr. Kohler. Appreciate it. Appreciate the insights in this first segment. We're headed to a commercial, folks. When we get back, we're going to talk about affordability, some of the veneers, the Instagram smile. You won't want to miss it. We'll be right back. Never in the history of healthcare delivery has an organization offered such complete care to Detroiters. Your eye care experience may begin in our state-of-the-art eye clinic, but it doesn't stop there. We can come to you. Delivering vision and home health care is the hallmark of the Eye Care for Detroit and American Advantage partnership. Helping you to feel better and see clearly is the perfect putt. Call Eye Care for Detroit today. Welcome back to the Home Healthcare Today show. We are still focused on World Oral Health Day. And Dr. Michelle Kohler is really educating us in a non-scary and non-frightening way about some methods and some steps to ensuring that we lead a healthier life when it comes to oral health, as well as looking out for caregivers and even our children, getting them started on the right path. Affordability, though, seems to be a question that a lot of people have. So, Dr. Kohler, when you think about the quote unquote cost associated with oral health, more than 76 million Americans lack dental insurance. And nearly half of us delay or skip dental care because of the cost. What is Delta Dental doing to address these barriers, especially here in Michigan?
Yeah. So Delta Dental, if you go to our website, we do offer several options for individual plans.
Yes.
So that is something that, anyone out there can have access to, not necessarily just through your employer, which I know is the traditional way people think about getting dental insurance. So that is definitely something that you would want to check out. Another thing I always encourage members to do, especially when we're out in the community at events with my team, is just to see if you are eligible for some sort of assistance program.
Yeah.
I think a lot of people out there feel like they won't qualify, but in some cases they definitely will. And that in some cases can, take care of a lot of the coverage, if not all of it. So it's always worth giving it a try, filling out the forms, completing all of the enrollment steps, and then seeing if you do qualify. But there are some other ways to access affordable services. A lot of our federally qualified health centers and clinics and things like that, they have sliding fee scales where you can get some discounted access to dental services, if not even for free, depending on what your income levels and things like that look like. So there are definitely options out there in the community for donated services as well. And through our foundation, we support a number of programs where members can access things like that. But like I said, primarily go to our website, see if an individual plan is right for you, or, try to see if state assistance might be an option, or visit one of those federally qualified health centers.
Okay, it's Delta Dental MI, Delta Dental Michigan, that's the MI.com. Speaking of insurance, the sponsor of our show is Meridian Health Plan in Michigan, right? And so when we think about going beyond insurance, where Meridian care above all else, going over and beyond, as we think about beyond insurance, for viewers who don't have the dental coverage, because we know members can go, of course, to the site, or for those who coverage doesn't go far enough based upon, their oral health needs. What other options exist, and are there some places that folks can go to, like maybe the Malta Clinic, for example, on Woodward Avenue? Are there other places folks can go to in our community for some dental care?
Yeah, there absolutely are. And, again, coming back to those community clinics, they are really well set up to offer a lot of different options for coverage and to at least have the basic services completed, sometimes at no cost to you. So a couple of examples, just MyCare dental clinics, the Wellness Plan, Central City Integrated Health, Porktown Health are all great options, here really within the 3 counties in the Detroit metro area. So I would recommend that people take a look at those. There are some other options out there. The federally qualified health centers, though, do tend to have those sliding fee scales, which can really accommodate that gap population that may not qualify for Medicaid assistance, and they may not have the option through their employer to access commercial insurance, and paying out of pocket for a plan is too expensive.
Okay, very good. So now let's have some fun. Okay. So there's the filters, and we could do so much with our photos nowadays. But there seems to be, on the side of oral health, there's also like the vanity of the perfect smile today, or the quote unquote Instagram smile, or the winning smile. So social media is filled with all these perfect smiles, as well as filters, veneers, whitening, jewelry. So, yes, the Hollywood look. As a dental professional, Dr. Kohler, many years, how do you feel about the trend? And is there a downside to pursuing cosmetic perfection?
Yeah, well, I love all the filters. I think
Yeah.
it gives a lot of options for photos and
Yep.
modifications and things like that. But
Uh-huh.
I will say
Yeah.
doing a formal modification to the teeth through veneers, crowns, or anything like that
Yeah.
really does come with a bit of a risk to the tooth.
Okay.
So I always educated my patients that anytime we go in and remove decay or we're touching the tooth
Yeah.
at all,
Yeah.
the tooth is alive. So you
Yes.
do run the risk that maybe, it doesn't go well. So we
Yeah.
do sometimes see preparations for crowns where,
Yeah.
the tooth dies, it ends up needing a root canal or something like that. So there is that risk, but more often, what the patients have to recognize is there's a lot of maintenance to veneers because,
Yeah.
and even to full coverage crowns that cover the entirety of the tooth because it creates a margin around the edge, and that is where food can get stuck. That's where bacteria can get
Mm.
in. And anytime there is leakage at that margin,
Yeah.
you're at risk for a number of things. So certainly sensitivity of the tooth, which
Yes.
in some cases can become unbearable and
Yeah.
irreversible. That's when we move to the root canal there.
Mm.
But
Yeah.
it always leads to decay. And
Okay.
then that means replacement of the veneer, replacement of the crown. Sometimes patching isn't an option. So I do always tell patients that if you want to pursue something like that, that's
Yes.
totally fine. I know we all like to have that beautiful cosmetic smile,
Yep.
but it does come with some risk, and then it does come with long-term maintenance. I would also say that any crown or veneer really can last somewhere between 5 years, 10 years, sometimes even longer if it's very
Yes.
well maintained
Uh-huh.
and if it's placed correctly and you have a very skilled dentist that's doing the work and
Yeah.
investing a lot of time into
Sure.
it. So that is something for patients to keep in mind as well as that replacement cost down the road.
I get it, Doc. Okay. Thanks for clarifying that. And as we shift back to some of our at-risk populations, underserved communities, some of our seniors, some of the groups that are oftentimes overlooked in this conversation, closing the gap. Delta Dental has invested in some very innovative programs, self-driving shuttles for seniors, the first LGBTQ plus affirming dental clinic in Michigan, school-based sealant programs. How do these efforts reflect a new approach to dental care access?
Yeah, well, I think it's really about making sure that the person is comfortable where
Mhm.
they are being seen. The relationship with the dentist and the mouth, it's
Yes.
very personal.
Yes.
So
Yeah.
patients have to feel comfortable, otherwise they don't come back.
True.
And when they don't come back, sometimes they don't even seek out another dental office because they
Ouch.
feel like the visit is going to be the same.
Mm.
And that's not always the case. It
Yeah.
does become a bit of a relationship and you have to try to connect with that person. So
Yes.
from the perspective of the LGBTQ plus community clinics, it is about making that connection and having,
Mhm.
that ability to feel comfortable in the
True.
space, feel comfortable with the person that's treating you,
Yes.
and know that they can really engage with you in a different way
Yeah.
that, will ensure hopefully a lifetime of visits and good oral health. Now, from the perspective of the school-based clinics and the sealants
Yeah.
and things like that, we're
Uh-huh.
really trying to meet members where they are
Yes.
because obviously children are going to school. Sometimes they miss school because of
True.
cavities and
Yeah.
things like that. But it's also difficult for parents to take the
Yeah.
time off work to get their child to a clinic. So
Yes.
if we can bring the services to the school, even better.
Yep.
And that's just a great way to, again, try to engage with the community, meet people where they're at. And we always try to support those initiatives as much as possible. And we want to expand access
Yep.
too, because it has to go beyond this traditional brick and mortar
Yep.
piece of it. So mobile clinics, the
Yes.
self-driving shuttles really
Uh-huh.
decrease that transportation barrier that we
Absolutely.
see a lot in the
Mhm.
underserved community. So
Yeah.
we're trying to get around a lot of those barriers there and just increase access. Like I said, it is part of our mission. It's oral
Wonderful.
health for all.
Absolutely, Dr. Cullen. I love seeing Delta Dental of Michigan in the community. The toothbrush giveaways, the toothpaste, the floss, and all of that. All of those activities, right? Really cultivate a person's experience and their journey along the way. So, as we wrap up our episode, a couple of more questions here. Any big events planned throughout the rest of the calendar year 2026 for Delta Dental in the community?
Oh gosh,
Yeah.
we have so many
Yeah.
events. So February is Children's Dental Health Month, so we've been out all over, doing Head Start
Yep.
visits and working with schools and things like that.
Yeah.
And then in the summertime is really when a lot of our
Yeah.
events hit. So we see a lot of block parties and things like that
Yep.
in communities that we go to. We try to get into the Upper Peninsula as well.
Okay.
We try to do as many health and wellness events as we can. We like to partner with
Yes.
those federally qualified health centers. If they're doing vaccinations, if they're doing cholesterol screenings,
Mhm.
blood pressure screenings, you know, those are all great ways to incorporate oral health.
Yes.
And then as it moves to fall, we're always at the back to school events where,
Yep.
maybe they're giving away school supplies and backpacks and things
Definitely.
like that. That's really near and dear to our heart. But
Yeah.
kind of continuously throughout the year, we try to make sure that we're at all of the oral health coalition meetings and things like that, that we're working with our community stakeholders on, women, infant, and children programs and things like that. We do try to work with PACE,
Yeah.
so
Okay.
programs for the elderly as well. And I would say, if we are asked to attend,
Yes.
we are always there.
I love it.
We have
Yeah.
a very strong team of outreach personnel. We get out there as much as we possibly can.
Absolutely, Dr. Kohler. We'll be happy to join you. I care for Detroit, now doing business as I care for Michigan with our mobile vision vans. Last question as we wrap up the World Oral Health Day episode. One prescription for folks. So we gave a lot of great advice, but if it's someone that's saying, I want to avoid the worst toothache ever, one piece of advice.
Take the first step today and make that appointment.
Yes.
We always tell members, don't put it off, because
Yes.
then, life gets in the way.
Yep.
Make that appointment, even if it's 3 months out, 6 months out, that day will come. And it is taking that first step towards, getting your oral health to the optimal level where you want it to be. And, even if you're not ready to make an appointment, take the first step by, starting to brush regularly,
Yes.
floss regularly, even just rinsing. Like I said, it only takes one little piece to build the habit over time, and you will see the improvement.
Absolutely. Dr. Kohler, this has been my distinct honor and pleasure. Thank you.
Thank you.
Thank you for all
Appreciate
that you do in the community, all that Delta Dental of Michigan continues to do around the state. Thanks so much. Every Saturday at 10 a.m., we bring the Home Health Care Today show, hosted by Dr. Cleamon Moorer and sponsored by Meridian Health Plan in Michigan. We bring health and wellness topics straight to you. Tune in at 10.
So with a brain-computer interface, you try and put a device around the brain, record the electrical activity from the brain, and use it as a bypass to either control a device, like control a computer or a robotic arm, or potentially one day even reanimate someone's own arms or legs.